The General Practicing Aged Care Incentive is a new model of care which provides incentive payments to GPs for delivering coordinated bundled healthcare for permanent residents of residential aged care homes. The aim is to strengthen clinical care for residents with the goal of improving health outcomes and reducing avoidable hospital visits. The General Practicing to Aged Care Incentive requires voluntary My Medicare registration for all involved: the GP practice, the responsible provider or GP, and the resident.
My name's Michelle Guppy. I'm the head of the School of Rural Medicine, and we deliver the joint medical program with the University of New England and the University of Newcastle, and I'm also a rural GP. There's been a significant drop in the number of general practitioners around Australia, and it's a problem Australia-wide. So we're actively trying to increase the number of our medical students who graduate with an interest in general practice as a career. We know that general practice is a very interesting career for medical students. It's diverse. So aged care is a really core part of work for doctors, not just general practitioners, but all specialties are involved in aged care.
My name is Dr. David Healy. I'm a GP in Armidale. I have patients and look after patients in all of the facilities in Armidale. I'm here today to talk about the new General Practice Aged Care Incentive and how it may help encourage more GPs to look after their patients in aged care homes. So the General Practice Aged Care Incentive is a new incentive from the federal government that links patients with My Medicare and with the practice. The idea is that this will give the practice or the doctor and the patient a common identity to help with their care. Because patients need to be registered with My Medicare, patients at the residential aged care homes will need to be registered with My Medicare with the practice before the incentive can be claimed. One way that residential aged care homes can help GPs and the practices with registering patients is with actually doing the registrations. It is a simple one-page form that just requires the patient's details, their Medicare number, the signature from the patient or their person responsible.
My name's Janelle. I'm the Facility Services Manager at Roseneath Aged Care Centre in Glen Innes. Yes, we are having trouble attracting the GPs. Glen Innes, it's a very small town. Finding the GPs is difficult. Our local GPs are incredibly overworked. The GPs that we deal with, they're registered. Doctors, their practice managers sent us the one-page document, just had it back the next day. Signing our residents up to My Medicare was extremely easy. It's a one-page document, takes next to no time. The doctors give us a list of who they needed to get consent for, forms signed, and that was it. It was done. All our families were receptive with signing up to My Medicare.
So if the residential care home can contact the general practice itself, the practice will be able to give a list of those residents that do need to be registered with My Medicare. Once the registration is complete, once that form has been signed, then if the form just goes back to the practice, then the practice will finalise the registration from there.
So I think the government's recognised that it's challenging to provide medical care for residents in aged care homes, and so the new incentive is a good development to enable and help GPs be able to attend residential homes and look after patients in residential homes. We're hoping that the incentive will improve the care of patients in residential aged care homes. Older people have such a rich life experience and such interesting life stories. They bring a wealth of wisdom. The relationships that GPs can have with older Australians is very rewarding, and it's a lovely part of general practice care.